Humanistic care is important to me because at the end of the day, the patient that I'm taking care of is another fellow human being who deserves the same level of dignity, respect, and compassion that I would want to be treated with. Going through med school, it's very easy to forget and to get lost in the books and the stress and forget why you chose to go into medicine in the first place. And while I'm studying, I like to keep in mind that the things that I'm learning are helping me build that solid foundation I need to give my patients the care that they deserve.
As a future physician, it's important to me that beyond paying attention to a patient's medical reason for being in the hospital, but it's also important to me to pay attention to their environment, their perspective, and their mindset. Because for us, it is a day-to-day thing to be in the hospital. For them, it is a big day in their life, which they're going to remember for the rest of their life. So I like to always check in with my patients and see how they're doing, because often I find that they don't always tell you off the bat how they're feeling, and see that they actually understand why they're there and everything that's going on, because it's easy to forget that they might not know, they might not truly understand, and it's important to take time, sit down with them, and make sure they understand that they're being supported.
Humanistic care is important to me as a future physician because at the end of the day, our patients aren't going to remember what we did to treat them. They're going to remember how we treated them and how that made them feel.
Humanistic care is important to me as a future physician because every individual getting medical care should be met with empathy and honesty and compassion. And without that humanistic care, patients feel a disconnect from you. And as a future physician and for medical students, I urge you to consider that these patients are not just patients, they're individuals. They're individuals that have life problems and stressors and conflicts and fears and worries and doubts about everything in life, including the medical system. So I think it's very important to understand all of these from each individual's level, because that comes into play when you're taking care of someone. So when you take the time to try to understand what some of those fears and those stressors or those conflicts are outside of the symptomatology of someone, that's when you're providing humanistic care. And ultimately, that's when you're forming a very strong physician-patient relationship, and that's going to provide the best care for someone in the end.
Humanism for me, really, I think it's a crucial part of healthcare delivery. Unfortunately, in healthcare, there's a lot of variables we cannot control. There's a lot of politics and policies and things that we really cannot entirely control. But the compassion and humanism in your care is something that's always within your reach of control. So for me, humanism becomes an essential part of my healthcare delivery.
Humanism is the gold standard of patient care that describes the attitudes and behaviors that demonstrate respect for patients' psychological, social, and spiritual or religious concerns and values. In the beginnings of the COVID pandemic, medical care teams were often the only ones guiding patients through uncharted territory. Often, they were the patient's last goodbye. Science and clinical experience have exemplified time and time again the importance of seeing a patient as a person with feelings, opinions, and experiences rather than a disease. It is important for me to provide empathetic and compassionate care to my future patients so that we can build a therapeutic alliance together so they can ultimately feel comfortable discussing their vulnerabilities. I want to create a safe space where a patient can feel valued and understood.
Humanistic care is important to me for serving my patients because I not only want to treat what is medically wrong with them, but I want to remember that they are a person that has feelings and express as much empathy as I can to deliver the best possible patient care.
One case that comes to mind was when I was working in the emergency department. A patient came in with severe abdominal pain due to his newly diagnosed Crohn's disease. As soon as I entered the room, he voiced his frustrations at having these recurrent Crohn's flares. Although I was in the ED where things tend to get a little bit more hectic, I took the time to take a full history on him, including a social history. Through this, I discovered that this patient smoked every day, drank alcohol every day, and indulged in comfort foods such as fast foods during his flares. I took the time to explain that a fatty diet, overconsumption of alcohol, and smoking would all make his Crohn's disease so much worse and was possibly leading to these recurrent Crohn's flares. He had no idea that his dietary or smoking habits had anything to do with his disease because no one had ever told him as much. After I advised him about these risk factors, he thanked me profusely just for explaining all of this to him, for taking the time to really get to know him and understand him as a patient, because no one else had ever cared to. This experience made me so happy because it made me feel like I was actually helping out a patient and really making a difference in his life, just by virtue of treating him with compassion and patience.
There was a time when I was working with a patient at Atlantic Care. He was a very ill man, but he didn't speak the English language. By my ability to be able to converse with him in Cantonese, I was able to get a better story behind his illness and able to further elaborate and help him promote his health even when discharged out of the hospital. And it was something that was very important to me, as well as kind of moved me that I was able to help this individual very closely.
One example of a time a patient responded favorably to my providing humanistic care was a patient I cared for in the ICU. She was unfortunately nearing the end of her life and felt as though her final wishes were not being respected by members of her family should she lose the ability to advocate for herself. I made sure to listen to her and use my voice to speak with her family members and her healthcare team to make sure that her words and her wishes were heard and understood by all parties. And while unfortunately the patient passed away, before she did so, she thanked each and every one of her healthcare providers for giving her those final moments the way she wanted. That is one experience I will always hold deeply in my heart.
I think about one of my most memorable patients. She was a geriatric patient with a history of multiple hospitalizations, maybe 10 in the past year. And she was just frustrated, and so I sat with her informally. I took off my stethoscope and we just talked. And she told me how she was frustrated because her care was fragmented across multiple hospitals, multiple physicians, and also multiple pharmacies. And she didn't know what she was taking or why she was taking it. So without her asking, I went through and I did a full reconciliation. I called every doctor, every pharmacist, every clinic that she went to, and I did a list of what she was taking and why. And I compared that against the list that she gave me. And there was a lot of stuff missing. And it was likely the reason why she was getting hospitalized over and over again. So I sat with her and I gave her a full list. And I saw the frustration in her face give way to relief. Nobody had ever done anything like that before, and suddenly she felt empowered over her own healthcare again. It's really the little things that matter, and that's what humanism is.
Throughout my time at the RowanSOM COVID-19 vaccination clinic, there were many different emotions and reactions that I noticed people were going through when they got their vaccine. One particular instance I remember was a young lady in her 20s came in with her grandmother, and honestly, it just reminded me of me and my grandmother. So when she came in to get her vaccine, you could see she was visibly trembling, she was shaking, she was hyperventilating, she was sweating. She was so nervous. So me and my colleague sat her down and we just had a conversation with her. We were like, what's going on? Why are you so nervous? Just take a few seconds and take a deep breath. So after she calmed down, we were able to find out that she had actually lost her grandfather to COVID, and she was so nervous to get the vaccine and she thought she was going to faint. So what we did was we took her to a private area so she wouldn't feel like everyone was watching her. We wanted her to feel as comfortable as she can. We got her some water, some snacks, and as I distracted her, I was just making small talk with her. We were talking about college and just random things, really to get her mind off of the vaccine. My colleague was able to actually administer the vaccine. She was so excited when she realized that she got the shot and she didn't faint. So just us taking a few seconds to really understand why she was so nervous and why she was so scared and thought she was gonna faint, we were able to make such a traumatic experience for her a little bit easier. So it really shows how taking a few extra seconds to listen to your patients and their needs and wants will really go far in the long run for them.
During a busy evening in the pediatric emergency room, I was helping to treat an adolescent patient who was accompanied by her mother. I could tell the patient's mother was stressed, and she kept mentioning that her husband was on his way, but her 3 younger children were out in the waiting room. While being incredibly supportive to the patient, she was also visibly worried about her unaccompanied children. I told her that I would go out to the waiting room and check on them and inform them that their dad was on their way. When I came back to the patient's room to tell her that all 3 children were okay and playing in the waiting room, you could see that a weight was lifted off her shoulders. She could now focus on her daughter, knowing that her other children were safe and happily playing.
My advice to a new medical student for maintaining their humanism is to always be on the side of your patient. You are a team, forming an alliance against an illness. Together, you have the power to navigate these experiences and achieve a positive outcome.
The advice that I would give to medical students starting off is to actually volunteer outside of the medical field in order to better understand any challenges or social determinants of health that the surrounding population and patients in general will go through, since they are also people and will have challenges of their own.
My best advice would be to really allow space for patients to process information, especially when they might be hearing something new for the first time, allowing them to really digest it and ask the proper questions, just like you would with a family member or a friend. And I would also say validating any kinds of thoughts or feelings that the patient is having is also really important to making them feel comfortable and accepted in the medical space.
The advice I could give to medical students now to practice humanism is to really look at yourself. When you're hurting, you can hurt other people, so it's important to practice wellness outside of medicine. Whether it be art, cooking, singing, dancing, find a way to connect to yourself and to connect to other patients. Secondly, figure out what your love language is. How do you communicate compassion? Is it through acts of service? Is it through gifts? Is it through kind advice? Once you figure out how you communicate to others, you can really tailor the way that you practice medicine.
I highly recommend that you write down on a post-it note, put it on your calendar, record yourself so you can review it later, the motivation that you chose to pursue this field. Remind yourself daily of what the drive was to pursue the art of medicine and people, because that's what the art of medicine is. It is the art of people. Because I know that in the craziness of your academics, it's easy to lose sight of this drive as you put your head down and get buried in the books. But I highly urge you to take a little bit of energy every single day to nourish the flame that was the fire of why you went into medical education and why you want to become a doctor. Because I think it's going to go a long way into ensuring your happiness and your enjoyment as you move through the field. And even more importantly, your patient satisfaction and how much they enjoy coming to see you in the office.
My biggest piece of advice to an incoming medical student is to remember that while you build a foundation of strong medical knowledge in school, medicine doesn't exist in a bubble, and our patients are people who contribute to their communities and are affected by their environment. Our patients deserve to be treated in a way that they can understand, access, and afford, which is only possible if we as physicians take time to provide patient-centered care.
One thing that I'd like for students to learn about humanism in medicine is to try and connect with the inherent worth and dignity of each person while they're with them, even if only for a brief time. This may seem difficult with the pressures you're going to have to deal with, economic, administrative, and having to deal with the frustrations of ever-changing technology and medicine. But we're still very privileged to have so much knowledge and information and to be able to assist others on their journey through life's most difficult times. Everyone you interact with holds a position of importance to someone as their child, sibling, parent, cherished friend. So I try and remember that. I feel like I have examples of humanism in medicine every day with interactions with patients, students, staff, and colleagues. I think especially when patients are anxious about a procedure they're undergoing or a new diagnosis, and you can talk to them about it with compassion and acceptance and help them get through it because of the connections you've already made, that makes it worthwhile.